Well, tell us a little bit about the availability of the flu shots.
Well, the deal is here at Quinn Healthcare, where I work, we are having to tell people this week that we don't have flu vaccinations for them. And a lot of people are getting worried that they may be running out, but it's not a supply issue. On the CDC website, all the analysts, they've demonstrated that they've done all the analytics, and the companies that developed the flu vaccination, there's a great deal of confidence that the supply is not down. What's down right now is the distribution chain, meaning basically this results from the fact that a lot of people are getting in early. They're getting those flu shots because they understand we're right in the middle of the pandemic, and it's so important you get your flu shot to protect yourself. So what's happening is smaller entities like my clinic, we're running out fast and we're reordering, but they're backed up at the manufacturer, and it's taking a while to get those orders out to the clinics. So the flu shots are coming. We just have to be a little patient. But note that some of the bigger entities like Walmart and Walgreens, they still have supply. So if you can't get it with your primary care doctor, go ahead and go to some of those larger chain pharmacy stores and get your flu shot because it's so important this year.
When would you say is the right time to get a flu shot?
Right now, today, if you can, because the deal is the CDC is advising everyone to get your flu vaccination by the end of October, if possible, because we're right in the middle of flu season. It's repping on up. I mean, it gets worse November and December, typically in January. But if you get it now, note that it takes about 2 weeks for your body to build up those antibodies to help so that you can fight off the flu. So you want to go ahead and get your flu shot as soon as possible, if you can today, and that way you can better protect yourself, because as I said earlier, we're right in the middle of the COVID-19 pandemic. And if you get the flu and you get COVID-19, then your immune system has to work extra hard. And then there's a higher likelihood that you can have a worse outcome. And then for some people, they may even lose their lives.
Why is it so important to get a vaccine right now?
Well, as I said, we're right in the middle of this pandemic. And we have to think about the fact that a lot of people, they're more vulnerable than others, especially our elderly. These individuals, I mean, it's very typical that they can't produce antibodies at the same rate as everyone else. Their immune system is in most cases slightly compromised. So they really have to get that flu vaccine, and it's being recommended, if possible, they get the one that's the quadrivalent, that's even more potent for those 65 and older. But also note that those with chronic medical conditions, especially lung conditions like asthma or COPD, this is also our vulnerable population, and they're hit the hardest with this COVID-19 infection. So they want to make sure that they get that flu vaccination, because we really have to understand that this pandemic is serious. But it seems like everybody is really taking note, because people, they're coming in getting those flu shots. I mean, usually our supply will last, our first supply, for a month or two. We run out already. We're already putting our second order. So people are getting those flu shots, but we have to keep encouraging them so that we can get everybody vaccinated, or at least as many people as possible.
All right. Thank you, Dr. Quinn. It can also help keep people out of the hospital.